I want you to picture something that happens to more people over 60 than almost anyone ever talks about openly. You feel the urge. You sit down. You push, sometimes for several long, uncomfortable minutes, and nothing happens, or barely anything happens, even though your body is clearly telling you it's time to go. Most people assume this means they simply need more fiber or a stronger laxative, and they reach for exactly that again and again with little to no real improvement. I need to tell you something that almost nobody explains clearly. In a huge number of these cases, the problem isn't that stool isn't reaching where it needs to go. It's that stool arrives right at the exit and then gets physically stuck there, and taking more fiber or a stronger laxative doesn't fix that problem and can sometimes even make it worse. I am Dr. James Parker, and today I want to walk you through a specific, very common condition that gets confused with ordinary constipation constantly, called outlet constipation. Understanding the difference between these two things changes everything about how you should actually respond to it. And I promise by the end of this video, you're going to understand your own body's plumbing better than you ever have before, along with a specific technique that fixes this for a lot of people almost immediately. Let's start with the core distinction, because this is the piece that changes everything. Ordinary constipation is generally about slow movement, stool moving too slowly through the colon overall, taking too long to travel from start to finish. Outlet constipation is a completely different mechanism. Here, stool has already made its full journey through the colon and has arrived exactly where it's supposed to be, sitting right in the rectum, ready to be passed. The problem is specifically at the exit itself. There's a muscle called the puborectalis, part of your pelvic floor, that wraps around the lower rectum in a sling-like shape. In a normal, healthy bowel movement, this muscle is supposed to relax and straighten out, opening up a clearer, straighter pathway for stool to pass through easily. In outlet constipation, that muscle doesn't relax properly. It stays tight, sometimes tightening even further under the pressure of straining, which keeps that pathway kinked and narrowed exactly when it needs to be open. This is precisely why someone can feel the urge, sit down, push hard, and still struggle, because the issue was never about stool needing to travel further. It's already there. It's simply stuck behind a muscle that won't let go. Let's walk through the specific problems that create and worsen this cycle, because understanding each piece here is what makes the solutions later in this video actually make sense. The first problem is stool getting stuck right at the exit itself. As we just covered, stool reaches the rectum. But because the puborectalis muscle remains contracted rather than relaxing, it doesn't pass through easily despite genuinely being right there, ready to go. Here's what makes this worse over time. The longer stool sits in that position without passing, the more additional water continues to be absorbed out of it by the surrounding tissue, which makes it progressively harder and drier the longer it remains stuck. So the core issue here isn't a lack of urge, and it often isn't a lack of fiber either. It's specifically difficulty emptying the rectum despite a completely genuine present urge to go. The second problem, and this is where so many people accidentally make things worse without realizing it, is straining too hard. The natural instinct when stool won't pass is to push harder, and it makes intuitive sense. More force should move things along, right? Except with outlet constipation specifically, pushing harder often causes the surrounding pelvic muscles, including that same puborectalis, to tighten even further rather than relax. This creates a genuinely frustrating cycle where the harder you push, trying to force the issue, the more that muscle resists and tightens in response, making the stool even harder to pass than before you started straining. Excessive straining essentially works directly against the body's natural relaxation process that's supposed to happen during a normal bowel movement, turning what should be a gentle release into an unproductive, sometimes painful battle against your own pelvic floor. The third problem is too much fiber without enough water. water. And this is an incredibly common mistake, largely because fiber gets recommended so universally for constipation that people assume more is automatically better. Fiber works by absorbing water and using it to soften and bulk up stool, which does genuinely help constipation in many cases. But here's the catch. If you suddenly increase your fiber intake significantly without also increasing your water intake to match, that fiber ends up pulling water away from elsewhere. And instead of softening your stool, it can actually make it harder, bulkier, and more difficult to pass. Particularly problematic if you're already dealing with an outlet issue where stool needs to move through a narrow, tight passage. The advice here is specific and important. Increase fiber gradually rather than all at once, and make sure your water intake genuinely increases alongside it, not as an afterthought. The fourth problem is using the wrong type of laxative, and this is one of the most important distinctions in this entire video, because it explains why so many people try laxative after laxative with disappointing results. Stimulant laxatives, common ones include senna and bisacodyl, work primarily by triggering contractions higher up in the colon, essentially pushing stool along that upper portion of the digestive tract more forcefully. If your actual problem is outlet constipation, stool that's already sitting right at the exit, stuck behind a tight puborectalis muscle, a stimulant laxative doesn't address that mechanism at all. It can trigger uncomfortable cramping from increased contractions higher up, while doing essentially nothing to help release the muscle that's actually holding things back at the exit. This is exactly why matching the treatment to where the constipation is actually occurring matters so much, and why the wrong laxative choice can leave people frustrated, uncomfortable, and no closer to relief. The fifth problem is ignoring the urge to go when it happens, something a lot of people do simply because the timing feels inconvenient, whether that's being away from home, in the middle of something, or simply not wanting to deal with it at that particular moment. Repeatedly ignoring that urge has a real cumulative effect. The rectum's natural signaling system, the mechanism that tells your brain it's time to go, can weaken with repeated ignoring over time. Meanwhile, stool that isn't passed when the urge first appears continues sitting there, with more water continuing to be absorbed out of it the longer it remains, becoming drier and harder, which feeds directly back into the exact stuck stool problem we started this entire list with. The advice here is straightforward. Respond to that urge reasonably promptly when it appears, rather than routinely pushing it aside. Now let's talk about what actually helps, starting with options for more immediate relief when stool is already stuck and you need a solution right now. Milk of magnesia is one option worth understanding. It contains magnesium hydroxide, and it works by drawing water into the stool, helping to soften it directly at the point where it's already sitting stuck. This can be a genuinely useful option, specifically in that stuck outlet constipation scenario. I do need to give an important warning here. If you have kidney disease, milk of magnesia should generally be avoided since impaired kidneys have a harder time clearing excess magnesium from the body, which can build up to concerning levels. And if you're on other medications or have certain heart conditions, checking with your doctor before using it is a genuinely important step, not an optional formality. A glycerin suppository is a second option, and it works quite differently from an oral laxative. Rather than traveling through your entire digestive system, it's inserted directly into the rectum, working locally right at the site of the problem. Because it acts directly where stool is actually stuck, rather than needing to travel through the whole digestive tract first, it tends to work considerably faster and more specifically targeted to exactly the outlet constipation scenario we've been discussing throughout this video. Now, here is the single technique I consider the most important piece of this entire video, the one that addresses the actual root mechanical problem directly, your position on the toilet itself. This might sound almost too simple to matter, but the anatomy behind it is genuinely compelling. Use a footstool somewhere around 6 to 9 inches in height and place your feet on it while seated on the toilet. This should position your knees higher than your hips. Lean your torso slightly forward and rest your elbows on your knees. Consciously relax your abdomen rather than tensing it, and breathe slowly, using your belly rather than holding your breath and straining forcefully. Here's why this specific position matters so much. It directly helps straighten what's called the anorectal angle, essentially the natural bend between your rectum and anal canal. In a normal seated position on a standard toilet, that angle stays somewhat kinked, which is part of why the puborectalis muscle has to work harder to fully open the pathway. Raising your knees above your hips changes that angle mechanically, straightening the pathway and making it genuinely easier for stool to pass through with far less straining effort required. For a lot of people, this single adjustment, changing nothing else about their diet or routine, makes a real, noticeable difference almost immediately. Beyond immediate relief, there are 3 specific foods worth building into your routine consistently for genuine prevention going forward. Kiwi is the first, and specifically, I'd recommend 2 green kiwis eaten with dinner. Research on kiwi specifically for digestive health has shown genuine benefits for bowel movement frequency, stool softness, and a real reduction in straining with consistent daily use, making it one of the more well-studied food-based options for ongoing prevention. Ground flaxseed is the second, at roughly 1 to 2 tablespoons per day. Flaxseed works by absorbing water and forming a soft, gel-like consistency that helps stool move more smoothly and comfortably. I want to specifically emphasize using ground flaxseed rather than whole flaxseed, since whole flaxseed often passes through the digestive system largely intact without being properly broken down, meaning you miss out on much of the actual benefit compared to the ground version. Prunes are the third, with a suggested amount of about 5 to 6 prunes in the evening, or roughly half a glass of prune juice as an alternative. Prunes contain a natural compound called sorbitol, which works by drawing water into the stool, helping keep it soft and easier to pass, making this one of the most well-known and genuinely effective food-based approaches to constipation prevention. Before we finish, I need to cover something important. Because while outlet constipation is common and usually very manageable with everything we've covered today, there are specific warning signs that mean you should get evaluated by a doctor rather than simply trying home remedies. These include blood in the stool, unexplained weight loss, a persistent change in the shape of your stool, particularly stool that's become unusually thin, sudden constipation that starts without any obvious reason behind it, severe abdominal pain, vomiting, or an inability to pass gas at all. Any of these, individually or together, can indicate something more serious happening beyond simple outlet constipation, and they genuinely deserve prompt medical attention rather than being managed at home. Here's the core message I want you to walk away with today. If stool is already stuck right near the exit, simply piling on more fiber or reaching for a stronger laxative often isn't the answer, and in some cases can genuinely make things worse rather than better. What actually helps is understanding this specific mechanism, avoiding excessive straining that tightens the very muscle you need to relax, making sure water intake keeps pace with any increase in fiber, choosing the right type of relief for exactly where the problem is occurring, adjusting your position on the toilet to work with your body's anatomy rather than against it, building kiwi, ground flaxseed, and prunes into your routine consistently and responding promptly when your body gives you that natural signal rather than pushing it aside. If this finally explains something you've been quietly dealing with, take a second and tap that like button. It helps this information reach more people who've been struggling with this exact problem without ever understanding why. And tell me in the comments if the toilet positioning technique made a difference for you. I read every single comment, and it genuinely helps me understand what to cover next. I'm Dr. James Parker. Take care of your body's signals, and I'll see you in the next one.